Ballad Health to realign emergency care and neonatal intensive care services prompted a local doctor to speak out. Good evening, I'm Josh Smith.
And I'm Sarah Diamond. Last week, Ballad Health revealed Johnson City would become the region's only Level 1 trauma center. Holston Valley Medical Center and Bristol Regional Trauma Services would be downgraded to a Level 3. And the neonatal intensive care unit in Kingsport, the Ballad Health officials want to remove it, making Nicewalker Children's Hospital in Johnson City the region's pediatric trauma care facility. Although Ballad's NICU plan still requires state approval, it did not stop people from speaking up during last night's Board of Mayor and Alderman meeting in Kingsport.
And one of them, the director of NICU services at Holston Valley Medical Center.
But I'm so proud of the pediatricians in this community. They're willing to speak out for their patients and put patients before profits.
That's Dr. Pius Powers, and he's not the only one who voiced concerns last night. A woman's Facebook video showcasing her backlash toward the NICU plan and the trauma plans gained thousands of views. Jackie DeFusco shares their side and reveals why Ballad Health says the changes are crucial for life-saving care.
Yeah, Josh, Sarah, well, that woman you just mentioned, her name is Danny Cook, and when it comes to this NICU, her concerns come from personal experience. She's one of many worried about the added distance and costs mothers will have to endure to see their babies.
Bella was born at 1 pound and 3 ounces. They told us when we got there, they said, we want you to understand that it's going to be a ride.
Danny Cook's granddaughter, Bella, spent 91 days in Holston Valley Medical Center's NICU.
You could see her heartbeat through her skin.
Cook says the NICU saved her granddaughter's life. Now she's one of many speaking out, concerned that these changes will hinder access and cause emotional trauma for mothers caring for babies like Bella.
Do you want to find out your baby is dead before you even have a chance to be there? And that's what this is honestly and truly about. I don't think that people get it. It's not just about surviving, it's about thriving.
Ballad Health executives maintain these changes will improve access to care, allowing them to hire 10 more pediatric subspecialties to serve the region. Plus,
the American Academy of Pediatricians, they all say the same thing. You should have high-risk newborns in a NICU that has a volume generally of more than 15 patients. The average daily census at Holston Valley is 7. The average daily census at Nicewalker Children's Hospital is 29.
But Dr. Powers, director of Kingsport's Level 3 NICU, contests what cases were included in that count.
Mr. Levine has consistently underrepresented how many babies are taken care of at Holston Valley.
Dr. Powers says in 2017, the NICU's average daily census was 11, and he says they admitted 280 babies that year, topping the number Ballad Health executives cited as those affected by the move by nearly 200.
100 babies matter. One baby matters. My daughter matters, and everybody else's granddaughter matters too.
Now, we did reach out to Ballad Health about these numbers. They sent us documentation supporting their calculation of that average daily census, and they also sent that to the state for review, we should point out. Now, Dr. Powers did not provide documentation, but he further explains that these differences are likely occurring because Ballad is not including babies that are transferred in and out of the NICU in their count.
Jackie DeFusco, thank you. Now, Ballad Health continues to maintain that physicians helped develop this plan for change, and they say it's supported by research that shows the best place to care for critically ill children is in hospitals with high volumes and multiple specialists trained to care for children. Ballad says that is something that is offered only at Nicewalker Children's Hospital in Johnson City.